Collecting data, identifying trends, developing strategies to prevent harm, reducing risk, sharing these practices, this is how you combat an epidemic. It's worked in the past. We use the same public health approach to dramatically cut automobile fatalities. We still drive where we need to go, but we have seatbelts and speed limits that help us get there alive. Public health experts are already working to address gun violence in real time. Last year, Congress passed the bipartisan Safer Communities Act. I want to salute my colleague, Senator Cornyn, who is here with us today, representing the minority. It took real courage, John. We may disagree on a lot of issues, but at a time when we needed to act, you did your best, and I thank you for that. It included $250 million in funding for community violence intervention and $250 million for states to provide comprehensive community mental health services. Let me give one example of the successful, innovative programs underway. In Chicago, I heard from doctors personally who were sick of treating gunshot victims on the operating table. They wanted to prevent the gruesome injuries from happening in the first place. So in 2018, I brought together the CEOs of the 10 largest hospitals serving Chicago to understand what they were doing in the neighborhoods surrounding their hospitals and how we can do more. We formed the Chicago HEAL Initiative, which has emerged as a national exemplar of how hospitals can collaborate and reach outside their walls to prevent gun violence. These hospitals have increased local hiring by 84% in the last 4 years. They've opened 24 school-based health clinics to serve 11,000 students and are training nearly 4,000 local students for careers in healthcare. Most importantly, these hospitals aren't just stitching up physical injuries. They're addressing the emotional scars of their patients. Through counseling and case management to prevent retaliation and promote successful recovery, just 2% of over 8,000 participating patients at the University of Chicago have returned to the hospital. Without these programs and this initiative, 45% of patients with a gunshot wound are likely to return within 5 years with another one. That is a stunning statistic. 45% within 5 years will return shot a second time. Similar steps are underway across the country to use this strategy, which is known as community violence intervention. CVI uses trusted community figures to engage with individuals at high risk of perpetrating or being victims of violence. They work to interrupt acts of violence before they happen and connect people with treatment and tools that decrease the risk of future violence. It's time for us to build on this bipartisan Safer Communities Act and ongoing efforts that are working in red and blue states. And join together, surely we can find some common ground between parties to create real change for the American people when it comes to this public health crisis of gun violence. I now turn to Senator Cornyn.